So unfortunately, 3 of today's cases relate to the emerging outbreak in our private residential aged care sector. One is the son of the initial case. You recall the first case in Maidstone Arcare, so it doesn't actually work at the facility but is clearly directly linked. One is a staff member at that same Arcare Maidstone who worked alongside that initial case. She was not vaccinated. She also worked at another aged care facility, the Blue Cross ACG Sunshine facility, on the 26th, 27th and 28th of May. That has therefore triggered a strong public health response at the Blue Cross facility, similar to what was activated to contain measures at the Maidstone Arcare facility. And the third additional case linked to the Arcare outbreak is unfortunately a resident, a woman in her 90s within the Arcare Magnolia unit, the workplace where the initial case worked. She is asymptomatic and is being transferred to a separate hospital that we've established precisely for this risk. Our thoughts are clearly with the residents, with the workforce and with the communities and families that they're all a part of. As indeed our thoughts are with everyone who is impacted by this virus. Currently, as the Acting Premier has indicated, there are more than 50 Victorians living with the virus right now, but there are many, many thousands more as either primary close contacts or secondary contacts doing it hard for all of us to stay safe, and I want to thank them. The fact that this outbreak has crept into a number of private residential aged care facilities is obviously of very great concern to the Victorian Government. It's of very great concern to all Victorians and indeed to the Commonwealth Government. Here in Victoria, we are very grateful for the support that has been put in place, be that from the Victorian Aged Care Response Centre, a joint partnership between the state and the Commonwealth. We're grateful to the Western Public Health Unit that has taken the lead in a number of response measures, and we're grateful to the Commonwealth and others who are working in partnership with us to respond to the outbreaks in private residential aged care. Since the start of the pandemic in 2020, we have put in place additional rigorous measures to protect our residential aged care facilities, our staff and most importantly, the residents. Whilst of course the Commonwealth is responsible for the regulation of private residential aged care in Victoria, Victoria has sought to assist that sector wherever we possibly can, including through the extensive on-ground support provided by our healthcare workers who have now completed more than 5,000 shifts of the state system assisting those private residential aged care services and which are indeed on the ground as we speak. We have also had in place in regards to the public residential aged care system a rigorous system in place since 2020 where we've continuously deployed a subsidy for our public residential aged care workforce to make sure that we reduce the number of crossover shifts between workers across different facilities. That has resulted in all of the metropolitan public residential aged care facilities making sure that their workforce is dedicated to one facility and in the high 90% in the regional public residential aged care facilities. We also have in place the $450 test isolation payments, so staff members can be compensated if they stay home whilst they are feeling unwell and can safely isolate whilst their test results are coming through. All both public and private residential aged care facilities have all been linked into one of our 8 health service hubs that we've had established since mid-2020. And they are the public sector health leads in each of the regions, and it is their job to work closely with both public and private residential aged care facilities on the important issues around infection prevention and control and lending the assistance where they can. And as a part of that, more than 12,000 staff have already taken part in personal protective equipment training, guided by expert advice and evidence, so as how to make sure that you are protected at work and that you keep yourself safe and you keep your residents and your family safe. So this is a very serious position for our aged care sector. Victorian Government is committed to working cooperatively with the private residential aged care sector, with the Commonwealth, to get ahead of this. And I might ask Jerome to take us through a few more of the details.